If you suffer from widespread chronic pain, you know that it can make you feel almost like a spectator in your own life. But a new medical technology may help you become a full participant again. Introducing BurstDR Stimulation, the latest advancement in neurostimulation therapy that could relieve your pain and help transform your life. BurstDR Stimulation is an FDA-approved therapy that was created by doctors to mimic naturally occurring patterns in the brain. This advanced technology is believed to address both physical pain and its effect on you emotionally. In numerous studies around the world, BurstDR stimulation has been clinically proven to improve performance of everyday activities. And one recent clinical study showed the majority of patients preferred BurstDR stimulation and received superior pain relief when compared to traditional neurostimulation therapy. BurstDR stimulation is a therapy that works to reduce pain by altering pain signals as they travel to the brain. With this therapy, a small generator, similar to a cardiac pacemaker, sends pulses through thin wires, called leads, to nerves along the spinal cord. The pulses modify the pain signals as they travel to different parts of the brain, changing the way your body perceives the pain. BurstDR stimulation provides potential relief from the physical pain and the suffering associated with the pain. One of the benefits of BurstDR stimulation is that you can try the therapy using a temporary system to see if it's right for you. With our temporary system, you can control your own pain relief through an easy-to-use app on an Apple iPod Touch mobile digital device. The small external generator easily hides under your clothing, so you can go about your day without anyone knowing you have it. Don't settle for being a spectator. It's time to treat your chronic pain and get you back to being a full participant in your own life. Talk to your doctor today to determine if BurstDR stimulation therapy is right for you. For additional information about BurstDR stimulation and to watch videos about patients like you, visit poweroveryourpain.com. While neurostimulation helps most patients receive at least some reduction in pain, not everyone responds in the same way. The amount of pain relief varies with each individual. Complications related to placement and/or use of the device may occur, including painful stimulation, loss of pain relief, and certain surgical risks such as paralysis. Be sure to discuss the risks and benefits of neurostimulation with your doctor. CE marking does not necessarily indicate regulatory approval status for all markets. Please refer to the instructions for use for a full listing of indications, contraindications, warnings, and precautions. RX only. Brief summary. Prior to using these devices, please review the instructions for use for a complete listing of indications, contraindications, warnings, precautions, potential adverse events, and directions for use. Indications for use. Spinal cord stimulation as an aid in the management of chronic intractable pain of the trunk and/or limbs, including unilateral or bilateral pain associated with the following: failed back surgery syndrome and intractable low back and leg pain. Contraindications. Patients who are unable to operate the system or who have failed to receive effective pain relief during trial stimulation. Warnings, precautions. Diathermy therapy, implanted cardiac systems, magnetic resonance imaging, MRI, explosive or flammable gases, theft detectors and metal screening devices, lead movement, operation of machinery and equipment, postural changes, pediatric use, pregnancy, and case damage. Patients should not be dependent on drugs and should be able to operate the neurostimulation system. Adverse effects. Painful stimulation, loss of pain relief, surgical risks, for example paralysis. Clinician's manual must be reviewed for detailed disclosure.